Ladies and gentlemen, welcome in. We are here on the Studs podcast. Just one stud today. Well, a studette. We got a special guest today. This is Mike. Hope everyone is staying healthy, especially today with the big news, which we'll touch on in a couple of minutes. First of all, you can check us out on the Anchor.fm platform /Studs podcast. You can make a donation if you like. Share us. We're on Spotify, Apple, Google, Overcast, Pocket Cast, and like 10 other things. So we're on everything. We got a lot of great content. If you'd like to check out the last episode we just did, we had a great guest, Will Winfield. He talked about high school football, the COVID protocols, and then went on a little Celtics rant as well, which we'll stay away from today because I'm very not happy with the Celtics. And we're going to introduce our special guest today. We have Jennifer Ebbitt. Now, I've known her since I was, I think, 12 years old, 13 years old. Yeah, 13 years old. It's been a long time. One of the most supportive, and I said the same thing about Will last week, one of the most supportive people. She'll support you through everything. Whatever you do, one of the most supportive people I know. Jennifer Ebbitt, nurse care navigator for HopeHealth. How are you today?
I'm great. How are you doing?
I'm doing well.
Good.
Staying healthy.
Stay healthy. Wear your mask, wash your hands, all that stuff.
That's it. Enjoying the nice weather.
Good. This is the best weather. I've been waiting all summer for this weather, so very happy.
Before we continue, what's your favorite, a random question, what's your favorite fall activity?
Favorite fall activity?
And I feel with you, it'd be completely different. Like, it's not going to be apple picking. It's not going to be like pumpkin. I feel with you, it'd be something like completely like unnatural. And I don't know.
Yeah,
it's out there.
Probably. It's not too off the cuff, though. My favorite fall activity is usually, in normal circumstances, going to Niagara Falls. We go up to Canada every single year in October and kind of take the foliage ride on the way up. But as it stands right now, the borders are closed and they won't let us in. So this year we go to New Hampshire and be a little bit more mainstream and do some foliage looking in New England. So it's all good.
Yeah,
it's all
awesome.
good.
That's awesome. Yeah, nothing. One of my favorite fall activities is just sitting on a Sunday and watching Red Zone all day.
Yeah, that's what happens in our house regardless, no matter what else is going on.
Is this your favorite season?
This is my favorite season.
Oh, yeah, me too. I
love it. It's just, it's refreshing. It's awesome. Mm-hmm. It's Halloween. It's Christmas. It's all the good things. I love it.
Halloween I can do without, but Thanksgiving, I mean, it's the best.
Yeah. Well, I know you would like Thanksgiving.
I do love Thanksgiving. That's my holiday.
Yeah.
Well, let's get into it. Obviously, we've been planning to meet for about a week now to talk about healthcare and stuff. And obviously, we had the biggest news coming out at 1 a.m. when I looked at my stocks, and luckily I was selling already, so I didn't lose anything. I gained.
Really good plan. Yeah.
But I saw the market go down like 400 points at 1 o'clock in the morning. I'm like, what the heck is going on?
Something is happening. Yeah.
I'm watching. I forgot what I was watching. I think I was watching some sports or whatever, and breaking news came on, and our president caught COVID, and politics aside, we hope we want to wish that on anyone, but being in the healthcare industry, how long have you been in the healthcare industry for?
So I have been a nurse since 2012. And I've been a hospice nurse basically since day one. I went actually to nursing school because I knew I wanted to work with quality end-of-life care and hospice care right from the get-go. So I was really, really lucky to fall into it very early on in my career. And prior to being an actual nurse, I used to work as a vet technician at an animal hospital. It was always the go-to person for dogs and cats and loves little furry things at the end of their lives. So I kind of felt like this was a niche for me. So that's where I landed. But it's been a different kind of world working in hospice and palliative care in a pandemic. It's been very different. Very different.
Do you mind going into that?
No, not at all.
Explaining how it's different?
Yeah. So I'll give you kind of a little bit of background of what I was doing in my role with HopeHealth prior to pandemic time. So I work right in a major health system here in Rhode Island. I'm in the hospital all day long. I meet with patients and their families back when families could visit. to discuss hospice care, whether that's inpatient hospice there in the hospital, inpatient hospice at our inpatient hospice center. We're really lucky. We have the only inpatient hospice center in the state of Rhode Island that we can utilize. So I was, really lucky to be able to work with patients and families, work on their goals, their wishes, their symptom management, oftentimes trying to get them back home with hospice care. And I was also sort of a support person for that hospital as well. So if they had issues or concerns, education needs regarding, hospice and end of life care, an acute care hospital, you're not going to have staff that are well skilled in that stuff. So I'm there to be an all around support person. So then, sort of cue COVID comes in, and quality at the end of life kind of falls by the wayside, right? Because everyone's just trying to get through and see their loved ones, save their loved ones. We're learning as we go. I mean, when you're dealing with a novel virus like this, it's not the same as dealing with a flu outbreak or an outbreak on a cruise ship, that what that germ is, what that bug is, what to expect. No one knew what to expect with this. So it was harder for acute care staff to kind of turn and say, this patient's probably not going to live. Sometimes they didn't give us enough, notice in their condition to say that they were going south. So it was really complicated. So we went from sort of quality focus on end of life of people being comfortable and supported and their families being supported to, people were dying much faster than we had control over. And people were dying alone. There's so much, and you can go on the media and you can see everyone, says their personal opinions on what they think this pandemic is really like in healthcare. People are getting hit by cars and we're calling it COVID, and, people aren't dying, they're just getting sick and they go home. We don't know what the lingering effects of this are going to be, and we didn't know what the conditions would be like of these people coming in the hospital. Just at the beginning of the pandemic, New York was scrambling for ventilators, and then we started getting all these people on ventilators, and then all of a sudden we're like, the people on ventilators are doing worse, so now we don't support them on ventilators. So we had to learn as we went, and people were, like I said, they were dying isolated and away from their families, and the families couldn't come in and see them. And it was absolutely heartbreaking and such a challenge. Because a lot of these patients.
Yeah, no, what I was going to say is starting my position at the hospital, patient transporting, these visitors only have literally 2 hours. I'm assuming it's the same at Rhode Island, but at Merriam, it's 2 hours, 11 a.m. to 1, and then 5 to 7.
Yes.
And once 5 o'clock hits, you see the scramble of people trying to get in here.
Yeah, and the line that starts an hour in advance. It's crazy.
Mm-hmm. And it'll be 8 o'clock, 9 o'clock. I work a little bit later, and just going by these houses, the rooms, just going by them and seeing just people, you can see a lot of them. You have no one there with you. You're so alone, and being a transporter, and a lot of what everyone does transporting, and even the nurses too. I feel like it's an added responsibility for, them.
Yeah.
What you do, even something, a lot of people think transporting is a little bit, that's a low level. I mean, transporters they add flow to the hospital. And without
we can't do our job.
Tough.
Yeah, we can't do anything in a hospital without every single piece of the puzzle moving together. We can't.
It took me a while. It took me a little while too. And when I first did it, when I first sat there, I'm like, wow, I'm a small compared to the doctors, compared to the nurses. I'm not anything in this hospital. And then you realize quickly that the nurses, they came up. One came up the other day. They're like, you don't realize how much, not me, but the transporters.
Yeah.
Do you don't realize how much you do for us.
No, you're vital. You're absolutely, no one can do their job unless there's someone else doing theirs. We all have to work together. And being that these patients are so isolated, you become their family, and if they're scared going to another unit, especially for you have patients maybe going from an ICU setting to a regular floor setting. So now, they're happy because they got out of an ICU, they're feeling a little bit better, but they're still not with their family, and you can bring some conversation and some levity to them from point A to point B. And it's crucial. It's crucial. So thank you for doing what you do. Cause I don't see everybody lining up to run heavy beds of patients all around the hospital. So you're doing a big thing for all of us. It's awesome.
No. And the bigger thing too is like I wanted to do that. Obviously a big move in my life, but I wanted to do that because when as a transport, when we're transporting these patients, whether it's to a CAT scan or an MRI or just getting them to their bed, you have to make them feel comfortable, and you have to build a
Yeah.
relationship with these patients to make them
Yeah.
feel better because they don't have their family by their side, and
Right.
that's been the biggest thing. And the nurses, transport, everyone, doctors, that's just another added responsibility. Like I said, that you have to make these patients more now than ever before feel
Right.
comfortable with what they're
And
doing,
not alone.
staying there and not
Yeah.
alone.
And if you've ever been a patient, if you've ever been in the hospital or even sat in the ER for a while, if you've ever been a patient, even before all this pandemic, it is scary and it is isolating. And even if you're in healthcare, the people around you are saying stuff you don't understand.
Mm.
It's scary. But sometimes you have your family that's in there at your bedside, or, they're coming in later and you have that support. Some of these folks don't have that, and they're in there
Uh,
by themselves, and they're people.
yeah,
A patient in a hospital is a person on the outside.
yeah.
So we have to remember that and really support them.
And to flip it too with these nurses, like I've been learning a lot about the emergency room and working in there. And to flip that, the nurses are people too. The people at the
Right.
front desk are people too. They
Yeah.
don't make the rules.
Right.
So
We just
a little
follow
bit,
them.
yeah, and a little bit more understanding sometimes. It's such a different time right now where I wish
Yeah.
nurses, especially nurses who have to tell a parent, it's time to leave. You
Yeah.
can't be here. I'm sorry. You got to go home. Call this number. A
Yeah.
little more empathy towards that, knowing that they didn't make the
Right.
rules. They didn't
Yeah.
create all this.
We're just all trying to get through and keep ourselves healthy and safe so we can continue coming to work and taking care of our patients, keep family members of loved ones healthy. It's not going to make anyone feel better if their loved one ends up in the bed in the room next to them.
Yeah.
We got to keep everyone safe and healthy. But I'm glad you said that though, because that's a big thing right now. And even now where we have those two areas of visiting hours, and a lot of hospitals have opened their doors to some degree. When we were at the height of this, there was no visitation.
Oh
It
yeah,
didn't
I know.
matter. It didn't matter. So there were people that were, I mean, standing in the driveways of the hospitals with signs, hoping their loved one could see it through the window. It is an actual truth when people tell you that they watched their loved one die over Skype. That is an
Yeah.
actual truth that happened, and it happened by the thousands in this country. I'm willing to bet. I've
Hmm.
seen it. I've held that phone. It is. I don't think anyone can prepare themselves for what it looks like watching a family say goodbye to a loved one in this format.
No, no,
It
no,
is
of
not
course
real
not.
life. It does not feel like real life, and it is heart wrenching.
Hmm.
So the fact that we even have these little pockets of visiting hours now, it really is. It's making some difference. It's not anywhere near what it should be, but it's making a difference.
How much? How much? How much longer do you see this in terms of visiting, limiting visiting? Do you see it going away again for a short time, or do you see it getting any
I mean,
extended?
I think that we're still looking at an extension because we haven't seen what things are going to do through all seasons. We
Mhm.
have flu season coming up. Kids have been back to school. Numbers are creeping, but how are we going to respond to those numbers? We have a little bit more information now on what this virus does and how it affects people. So, we have more information, and that's what we didn't have when this all started. It was we were getting what we could from around the globe, but how reliable were some of our sources? So we had to kind of learn it on our own, but we have a little bit better handle now. It's just a matter of getting it done, but I see restrictions for quite a while. Even once there's a vaccine, you know we don't live in a world where they're going to line everyone up and force everyone to get a vaccine. So even if it's available, you're going to have people who aren't able to take it or not willing to take it. So we have a road ahead of us, and I don't see life getting quite back to normal just yet. So we find that middle ground of new normal and roll with it.
Absolutely. Uh, my next question to you before we go, more of what you do. Uh, do you, how can I word this? No, maybe we'll get back to it.
Okay.
I
Okay.
think oh, no, here's what it was. The long-term benefits. I had a brain
Okay.
fart.
Yes.
The long-term benefit problems that come with this are still very unknown.
Still unknown.
That's the one unknown that I was going to bring up.
Yeah.
The
So,
long-term
yeah, and if you
effects.
think about it, people who had it, say in January, February, before we really knew what was going on, they haven't even been cleared from it for a year. Some of our recovered folks out there in the communities, they haven't been recovered from it for very long. And I mean, there's been celebrities that have had the worst complications. There's been, Red Sox players that have had the worst complications from this, the cardiac complications and the respiratory. So it's not just like a flu where you get body aches and you get, potential for pneumonia. I mean, this is really affecting us bigger. And who knows how that's going to affect people 2, 3, 4 years down the road. Just like any, severe illness, it's got lingering effects. We just don't know what they're going to look like yet.
And you brought up sports. I mean, we're big on sports on this podcast.
I know.
That's why a lot of athletes,
Yeah.
that's why a lot of athletes dropped out.
Right.
They didn't want to do it because of the long-term effect.
The long-term
What's going
effect.
to happen to me a year from now, 2 years from now? Am I going to
Right.
have heart issues? What's going to happen?
Right. And can they risk their career for that?
Mm-hmm.
And they have the option of saying, no, thank you. I'll sit this season out. That's fine for me. Those of us that have been essential workers this whole time don't have that luxury. So we're out there trying to protect ourselves and protect our community. I mean, sports players, we have to be part of the solution. So if you don't have to be there, don't be there. And a lot of them took that way out. So you see, I can't think off the top of my head who it was now, but there was a Red Sox player that had all the he had all the cardiac complications. Erod had all the complications. And you figure you're not going to find someone healthier, really, right, than a major sports player. Mm-hmm. And if he can get that sick, he might be a very small percentage, but that's still a percentage. Those people are still being affected. So, yeah, I think we have a lot to learn moving forward from all this.
Absolutely. I do have one more question for you.
Yeah.
In terms of, because you saw like what the government did during the shutdown and probably will do again, like releasing checks for people who are unemployed. Yeah. What about for frontline employees, frontline workers? What about for them? Like, do you see like any extra money? Do you think? I think they do deserve extra money. I think like whatever the amount is, they deserve. A nurse deserves a big fat check at the end of this, or something more added to their paycheck every week.
Yeah, I think some of the people that have been doing the things they've been doing through this, all of it, have been some of the strongest people I can think of, to leave your family in the face of like a real sort of dystopian kind of situation. We're faced with something that many people have never really had to live through, let alone work through and be part of the solution. So even healthcare workers, even retail food workers and everyone that was out there, I think everyone, I think it'll come and it'll come in one way or another, whether it's monetary or not. I think something good's got to come out of this for those that really stuck their necks out there, because some days were scary. I mean, Absolutely. You're realistically walking into places wrapped in plastic with hazmat suits on, and no one's touching anybody. It was scary, and I think we'll all take some time to kind of recover from the things we've had to see. But yeah, if I had my way, I'd be cutting checks for all of them, because they deserve it. Amazing things people have done through this.
And has that even been talked about? Like, has that been talked about at all?
I think it has, but I think the bigger piece of trying to keep the world online and keeping, as silly as it is to put money before people, money is always something we got to consider. Economy is always something that has to get considered. And I think we're trying to do too much with too little, and it's just nothing's quite working right now in that way. But absolutely, I think everyone that's been out there working has deserved everything and more for what they've seen and what they've done.
Absolutely.
Yeah.
And I think what happened, with the president, I think, when you go back to March, when the NBA shut down everything,
right?
Like that night, like it was like just chaotic.
Yeah.
And I think, I had a sense of like, oh, this is real.
Yeah.
Like, I had a sense of like, this is real that night. And, I remember being at the school, I came home listening to it on the sports radio. They announced it to cancel it, whatever. I'm like, how are we going to teach? How are we going to do these things tomorrow? And we ended up doing it. And that was one of the last nights of normality. That next day,
Yeah.
that was it. That was it.
Yeah. Yeah.
I walked into the supermarket and everything was wiped.
Blown
It
out.
was like an apocalypse. Like the
Yeah.
aliens just came,
Yeah.
which they will one day. But it was just like it was nuts. And for a while now, you've kind of, I feel like with the election and with politics and everything, I feel like it's kind of not took a back spot, but it's kind of calmed down just a little bit,
It
even though in
has.
reality it hasn't.
Right. And I think some of it is just we've just gotten used to it.
Yeah.
Right? We've all just learned kind of how to do things differently. But I
Yep.
think we all had that moment of, oh my gosh, this is real.
But I
We had
think
gone
today
out.
is another moment.
Today's another moment that it's still there. So I mean, if we can conceptualize this. So you're not going to find somebody more protected from the dangers of the world than the leader of the free world, right? Regardless of who the president is, regardless of what people think of him, her, or whatever, you're not going to find someone more protected than that, or screened, or whether or not he wore a mask everywhere he needed to be. Regardless, you're still not going to find a safer safety net around anybody. And if they can be infected, I hope that speaks volumes to people that it can get everywhere, and it is getting everywhere. It's not just going to hit the little mamas and papas in the nursing homes, and it's not just going to go around a daycare. If it can get through all the safety nets wrapped around the president of the United States, we are all susceptible to getting sick. And it proves that diligence, that maybe there was one hot second where he didn't have a mask on, or someone around him didn't have a mask on, or something was touched and not wiped down. It really is that minimal of an exposure that it's there and you got it.
Absolutely.
So I
Yeah.
hope that speaks volumes to people, because it should.
Absolutely.
For sure.
It's another. I think it's definitely another defining, like, between that night, Wednesday night, because sports is a connector for a lot of people to real world issues. Like when 9/11 happened, it was George Bush throwing out the first pitch at the Yankees game.
Yeah.
When Osama bin Laden was
Yeah.
killed.
Yeah.
That was during the middle of a Phillies game.
Yeah.
Whatever the teams were.
And the Boston bombings. Yeah, I was just going to say that. I mean,
sports was a way to do that.
One.
Yeah. Sports was a way to,
unite and connect people.
And then you have something like this. Yeah. And
where
then you
now
have something
it has,
like this now.
Yeah. It's taken, your jobs, your businesses, it's taken your kid out of school, and now it takes your baseball season. It takes all of those things. I have family that, I had a nephew that was a senior in high school last year, and he missed out on his, more than half of his senior year. You think it's just the little things. No, you think it's these little things that it's taken from us, and all we can hope in all of the ugliness that all of this is kind of snowballed is that we take a silver lining, and we find a way to march forward and get better from all of it. There's got to be something good that comes out of something like this. And I keep reminding myself of that whenever I have one of those, oh my God, moments, like, this is real. That first time you go in a store and come around a corner and someone's not expecting you, and they look at you like you're the boogeyman because they don't want to be that close to you because they don't know who you are. It's the first, we've come a long way since March, but we've got a long way to go. And I just hope that we come out of it a better society, more so than, some of the ugliness that's easy to see.
No, absolutely. Absolutely. All right. Let's get into more of, if you want to reiterate, I know you spoke about it a little bit earlier, but what you do at Hope Health, and the services you provide and the types of care.
Okay. So Hope Health, I've been with Hope Health for going on 8 years now, 7 years. And we're the second oldest hospice organization in the United States. So it's pretty cool to be part of history, because, hospice work has been done for a long time, but a real hospice movement hasn't. It's counted in the tens of years, not the hundreds. But what hospice is at the core is what I always think of wartime nursing always was. identify when you're at a point where you can't get better, and you have someone there who's making you comfortable and telling you all the wonderful things that you've impacted the world before you leave it. So it's really an honor to do end of life work, and I think our agency does phenomenal work, especially seeing that the stories that have come out of this pandemic have been just amazingly moving, the things we've been able to do for people. So, I see it more of at the acute level, being in the hospital, and coordinating all these patients and their families into, hospice care. I'm lucky too that I get to coordinate some people into one of our home care programs, because they're not at that point in their lives, and we want to get them better and stronger and, recovered. So our home care teams are fantastic too. But hospice, it's just a special thing that I think has been growing and growing for a long time. And every year the need is greater as our population ages and as this pandemic rages on. It's underutilized. I wish in our society and in our culture we were better at talking about death, because, I don't ever want to be that person who comes out and says it, but none of us are getting out of this alive, whether it's in 10 minutes or in 10 years or whatever, and I think we can do better as a society to normalize those conversations, so it's not quite as ugly at the end as sometimes it is.
What in terms of normalizing these conversations, is there, what kind of research is there behind it? What do you do to make those conversations more normal?
So there's a lot, actually. And so part of our organizations, we have a palliative care team, which is physicians and nurse practitioners. We've actually worked with Brown University to put in it's called Complex Care Conversations. And it's essentially teaching anyone who works in a healthcare capacity, from the transporter to the physician to everybody, how to have hard conversations, or how to be present and talk to a patient that's been given really tough news. So that's something that we as an organization offer the community. But bigger than that, there's lots of things out there, lots of movements and resources try to help people have these conversations. One of them is my favorite thing in the world, and I'm going to plug it because it's on Amazon, is the Death Deck. And it's basically a board game. It's like a Cards Against Humanity game where you can ask people their thoughts on death and dying, what's important to them, what scares them, what they'd want to know and not want to know. Super, these are the kinds of things I have in my house, by the way. Yeah. Like, this is my life. Yeah, it's just part of the reality. But yeah, and there's lots of resources online. It's just, we tend to do this. When it's death and dying, it's considered negative. We don't talk about it because, don't talk about it. I'm not dying, I'm fine, but then when, your health starts to take a turn, that's not the first time you want to talk to your families, and your loved ones about what's important to you. Some people are okay fighting through pain and hospitalizations and really being, going out fighting, which I'm never a big fan of this fight kind of a thing, because I feel like it always sets us up to, if you fight a disease and you lose, it just feels kind of defeating, right? But if we honor that time of that fight and kind of look at it a little differently and really take back the driver's seat and decide what's important for us faced with something like that, it takes the sting out of it. If you can have a conversation with your family and prepare them, hey, if I ever get sick and I can't really make decisions for myself, this is what's important to me. This is what matters to me. I don't think there's any time that's too early to have that conversation. I've lost very close friends very young. My, family very young. I will say from personal experience, the best gift I ever received was my mom always being very open and honest about what she would want when she died. I don't want an open casket. I want to, this is my outfits in the closet whenever, that's what I want to wear. She was always very clear with what she wanted. And then when we lost her, it was, okay, all those things are known. We just do them and bond as a family. I see so many families struggle because they have no idea what their loved one would have wanted for decisions. Do they want a feeding tube? Do they not? I don't know. I don't want to lose her, so I want to hold on to people forever. There's a quality over quantity conversation that we tend to not want to have, because science has given us so many options to live forever. people don't want to say, Goonies never say die. We don't want to say that either. And it's hard to start that conversation when things are dire.
It's preparation.
It's
That's it.
preparation. And that is sort of the defining characteristic of what palliative care is. So hospice is when we know there's a diagnosis where there's no more treatments. We know that the prognosis for that patient, their life expectancy is, probably around 6 months or less. Palliative care can come in much earlier than that when you have someone who's got just a chronic condition, whether it be cancer, heart disease, something along those lines, really bad COPD. You start having those conversations early of, this is a tough diagnosis. We don't really have a cure for it. So you're going to be living with it. And what's important to you, should this not reach a point of recovery that we both wish for? It starts people thinking of, well, geez, I'm not going to live in the hospital. I want to be home with my family. Or to hell with it. I want to fight on and stay in the hospital and do what I have to do. If I go down on events, then I do. Not everyone's wishes are the same, and we just have to honor them and know them sooner, because then it gives you back some power in your healthcare decisions. So
And that kind of brings up the next thing, the 5 wishes.
yes.
5 wishes document, and
Yeah.
I got it right over here, and if I can, and you have it right there. Yeah, that's an example one already done, right?
So this is one, we order them and have them to hand out to our patients and families. I'll bring them to doctors' offices. I'm not afraid to say that when in the early part of this pandemic, I mailed these out to my family because I said, this is a gift that I want you all to give your families. It's cool. So we'll kind of take a back step, advanced directives. So like a power of attorney, that kind of thing. So someone you appoint through a legal document that you can print off the Department of Health website for your state, basically saying, if something happened to me and I couldn't make my own decisions, I want, my husband to be my healthcare decision maker. I don't want to be resuscitated, or I do want to be resuscitated. That's kind of like the black and white version. This one puts your words into your wishes, and allows your family sort of a blueprint of what you would want if something were to happen to you, or what you want for your services after you die. It's really cool. And I've seen families of patients that have filled these out just be able to read it and laugh. I've had a patient that filled out the section of organ donation. Would you want to donate your organs or not, and why? And hers was, I want to donate my organs. I want to help anyone I can if I'm not living anymore, but please make sure I'm dead first. So those things it's funny, it's in their voice, it's in their handwriting. It's a very human, very connective way for families to help make these really awful, hard decisions. It's not legally binding, but
When you talk to people about it, are you surprised by their reaction? Do you find that actually more people positive about it, or do you still find that I don't want why are you asking? Why are we doing it?
I think by the time I get invited in, a lot of times that conversation's been had at least a little bit, so it's not coming out of left field. But when I'm sort of part of those conversations earlier, I think some people are definitely, just want to stick their head in the sand and not face it. Cannot believe that I would, anyone would imply that this, wonderful grandmother who's 100 years old, who's fought everything, pneumonias and everything up until now, could possibly die. But accepting that it's going to happen to all of us no matter when, and getting people to kind of wrap their heads around it instead of doing so many more tests and treatments and things. Some people are very good about end of life and some people aren't. And I'm actually kind of surprised when I do run into a family that's very comfortable talking about death or their own death, especially if it's a patient that can talk about their own death. I think it's exciting for me because there's no better person to tell you about what they want than that person. So I've seen some people be able to really die that Hollywood death and bring their families around them and eat Chinese food and drink beer from a straw and die with a smile on their face. And I've seen patients that didn't want to let anyone think that they would give up. and stay in the hospital and fight to their very last breath. And people have very different ideas of what death and dying is and what's important to them.
You, I'm not a big 60 Minutes watcher. I mean, I just caught it one day, just on, and they had, I think it was like 6 months ago, maybe longer,
Hmm.
maybe shorter. They did experiments with like mushrooms and psychedelic drugs and something,
Yeah.
psilocybin, something like that.
Psilocybins. Yeah.
Yeah, psilocybins, and
Yeah.
people were actually like, they were talking about how they went to heaven,
Yeah.
and so, or whatever, whatever you believe in,
Hmm.
they came out of it and they were like, I'm okay. I'm okay
Yeah.
to die.
Yeah.
There's a different, however that made it happen, however it works and the chemicals
Right.
it works in your brain, that they
Right.
were okay with it, or maybe not okay, but more comfortable
And it's
with
the
it.
fear of the unknown. So anything we do for the first time is terrifying. And death is the only thing we can't practice.
Yeah.
You can't, you want to go on a roller coaster, so you start on the Ferris wheel. We don't get that go round on a death run. Some people have those horrible accidents, or they end up in a coma for a while, or they end up on some kind of drug or medication that kind of gives them a glimpse of what to expect, whether it's scientific chemicals or something bigger than us, whatever you believe it to be. If it gives you a sense of it won't be that scary, it takes off that fear of the unknown. So it's
Absolutely.
it's pretty cool. It's pretty
Absolutely.
cool.
And what you do is definitely the best way to prepare everyone for that, because that's the big word, preparation, being
It's
prepared, and
preparation.
what you
Yeah.
guys do definitely helps with that.
Yeah. And it's awesome to see. So if the formula works perfectly, we go from, caring for patients at home while they are trying to recover or getting back on their feet from another hospitalization. They're still healthy enough to live at home. We do rehabs and we get them on their feet. And then things aren't going well. Palliative comes in and starts saying, hey, that was unfortunate. We had a change. We weren't expecting that. How do you feel about that? Getting people to really just stop and think, yeah, no, that was crappy. I don't want to go to the hospital again, or whatever. Manage their symptoms, help them breathe better. Um, and then that kind of gives way into a later stage of disease where we aren't going to be able to get better. Our worst day 2 years ago is now our best day. And then hospice can come in and focus a little bit more acutely just on symptoms. So it's a really nice handhold from point A to point B. And it's nice to see it when that all comes together, and it's nice to see collaboration in that way, to go from
Absolutely.
a state of more health to less health, but do it in a way that's supported and open, and um, just not turned away from, just kind of honoring what's there. Yeah.
Absolutely. Do you guys do a program, or for a 30-year-old man who's no help,
Hmm.
who's fine, like, and he wants to find out, do you work with, or is it only patients that have had issues, or do you have like programs where, all right, this healthy man, no issues, wants to come in and prepare and talk about dying, and all that
Yeah,
stuff.
so we don't really have a program necessarily quite for that far down the pike of health. But I will say, if anyone's interested in it, death cafes. It is sort of one of my hopes in life to host one. It's an open forum similar to what we're doing right now, where back in the days of being able to sit in the same place with other people in real life, you sit around, you have coffee, pastries, and you just talk about death, your experiences with it, what scares you, what comforts you, not planning, just talking about it. There's a specific format that the people who designed it want you to follow, because it really is kind of proven to be the right way to have those conversations. But it's fascinating to want to just have people sit and talk about death and dying in a way you'd sit down and talk about sports. It's very freeing. And there's not many in our area. We're very kind of closed minded on death in the New England area. But if you go out to like Oregon and places where it's a little bit more forward, you have really great, cool opportunities like that. But those are great to look into if you really are a young, healthy person who wants to start having those conversations. We kind
Awesome.
of come on the backside of it. where we have lots of grief and bereavement programs. Anyone who's on hospice services, when they die, our agency will follow them, or any hospice agency will follow that family for 13 months. 13 months, because sometimes you don't know until the first anniversary of that death rolls around that you might not be okay and need a little bit more support. So we're available to patients' families, anyone who loved them, to support them in the grief and bereavement world after the fact. We also have things like Camp Braveheart, which is a grief and bereavement camp for children who have experienced loss, and not just patients that we've cared for. Anyone in Massachusetts, southeastern Massachusetts, and Rhode Island, any kids that have experienced loss can come to that camp. And I was lucky enough to volunteer at it last year, and it is awesome. The activities they do, they just allow kids to be kids, but then kind of sneak in these little ways for them to bond through their losses. It's fantastic.
Can you send me those links? You have any
Yeah.
links to those?
Yeah,
I'd love to share that.
lots of links. I've got lots of
Awesome.
links.
Yeah, I'd love to share that.
We've got virtual education now I can send you links
Mhm.
for. Anyone who's social work or nursing that wants to watch this and take note. We have virtual education that actually gives you CE credits towards your licensing. So we like that. But
That's
I'll send you
awesome.
all kinds of links. But Camp Braveheart is just, I've always loved it, but seeing it in action was very, very special. Very cool.
And where's that held?
So we hold it. It's moved around in the last couple of years. It's usually at like a YMCA summer camp setting, so kids can do sports and activities, and then kind of sit down in small groups and do more of that bereavement focus work. This year, unfortunately, we had to go to a virtual platform, like everything else.
Yeah.
But it was still really successful, and we found ways to still be able to support these kids, which was the whole idea. So. It's very cool.
Yeah, definitely send me those links. I'd love to post them up.
Yeah, yeah.
On our page. And I'm sure just by you saying that, someone might feel a little more, and listening to this podcast, someone might feel a little more comfortable now, wanting to talk about this, wanting to maybe prepare, wanting to become more comfortable with this. So that definitely helps. I'd love to play games right now.
Okay, let's play
And I understand you got a game.
I got a game. I got
a game for you too. It's going to be totally out of the thing. But before we get into it, I'd like to share, and I'm going to share this upstairs too. Upstairs. Oh man, I can't talk today. I'm going to share this up in the link. I found this before we did the podcast. It's nursingworld.org. When we were talking, giving frontline workers more money, which they deserve.
Yeah.
Especially nurses, especially doctors, people on the front line, especially you.
Yeah,
everything.
My heart goes out to the respiratory therapists in the world, because of all the things in nursing I can handle, which is basically all of it except like respiratory gunk and goo. They have just been up to their ears in it with this pandemic. So like all power to the respiratory therapy teams.
Absolutely, absolutely. And you can, I'll share the link. It's nursingworld.org/foundation/donate. It's a foundation that raises money for nurses. And it's direct so financial support. We rely on donations. So you do direct donations. You can honor a nurse. So if you know a nurse that's just gone above and beyond.
That's awesome.
Yeah. So it's, I'll definitely share the link. Up above in the description, but let's play a little game right now. So what do you got for me?
All right, so let's do. All right, let me see. I had a thought, but now I want to change it. So hang on. All right. So this kind of talks a little bit about what we've been talking about. So the question to you is: you're diagnosed with a serious cancer. You want your doctors to A, lay it all on the line, tell you every single piece of stuff that you could possibly know about your cancer and what to expect. B, just focus on the next step, just what comes next, and not to overwhelm me. Or C, talk realistically to my loved ones, but stay optimistic with me. So basically tell everybody else the truth and then let me live through my rose-colored glasses.
Can I do A and C?
I think that's okay.
I
Yeah.
would love to know everything. I'd love to know everything, and then I'd love to be
Yeah.
optimistic at the same time.
Yeah. And I will say, so a lot of, and this goes back to Mike's living in a veterinary world before a nursing world and now a hospice world. Um, my thing is a lot of times, especially because there's so many specialists out there that collaborate on our care, teams tend to focus on treating the disease and not the whole patient, right? This is how I treat this disease. This is the treatment. But if you look at the whole person, sometimes that treatment plan doesn't work for them. So I like that answer of, lay it all out on the line for me, but it's for me. We're treating me, not just this thing you found on an MRI, right?
Absolutely. Yeah.
And stay optimistic. Hope has a lot of meanings as far as things go. We hope we get better, and then we hope we live a quality of life that we are happy with if we can't fix it. So hope changes, and staying
And you bring up a good
optimistic.
point too. Not one. It's not one size fits all.
No,
Like like this hat. It's not one size fits all.
right,
It's.
right.
I don't even think this hat fits me.
No,
But it's like it's not one size fit all for treat.
right.
Everything is different. Every person needs different
Different
affection,
care.
empathy. Some people don't want empathy at all. Everyone is different.
Right. And it's even it goes into even your religious beliefs. I mean, there's some religions that don't allow for blood transfusion. There's lots of stuff to take into effect. That whole person is more than just their illness, and it's hard to remember sometimes.
Yeah.
All right, there's one. I got one. I got more for you.
All right.
So what keeps you from talking more about death? Is it anxiety and worry about my own demise? B, it stirs up too much grief from my prior losses? Or C, nothing. I accept it and talk about it pretty openly.
I can't say C because I don't. I don't
Right.
talk about it at all.
Yeah, I'm a big fat C.
I
Just
yeah. I never. I
spoiler
never.
alert.
This is my first. This is like never really talked about it. I would
Yeah.
say maybe B.
Yeah, because it's
Yeah.
hard, and especially being young, you wrap all you know about death as is the pets we grow up with, grandparents and great grandparents and that kind of thing.
But what I would say too is
It's
it's
hard.
not like it's more or less like when I said before, like whoever's listening to this, for me, I never thought about talking about it. So
Yeah.
I don't know if I have a problem talking about it.
Right.
I never thought about it at all.
Yeah.
So, maybe I don't have a problem with it going forward. Maybe that answer
Yeah.
changes to C,
Yeah.
but I just
And
never did it.
just being able to entertain me on your program today tells me that you're probably leaning towards a C,
Yeah,
right?
yeah,
It's
probably.
okay to bring it in and talk about it. It was
Yeah, yep.
it was a steep jump from sports and music to the crazy lady who wants to talk about death and dying.
And that's what we want. And that's the biggest thing. That's why I made that post, because this is a topic I would never have thought of.
Yeah.
Maybe working in the hospital, and I would love to talk with nurses, and
Yeah.
it's definitely something I want. But we want to talk about everything on here.
Yeah.
And this is definitely, and that's why we made a post like that. We're going to continue to do that. That's what we want on here. We want these conversations.
Yeah. And I think
We
it's
want
important.
different conversations. I want I want to do a podcast about aliens, complete
That'd be good.
aliens.
That'd be good.
And yeah, I mean, I want to find people who are willing to come on here and talk about, alien encounters.
Yeah.
If they ever have
do it.
one, I would
You know?
I would love that. I'd believe
Yeah.
everything they say. But I'm just
That's
kidding. But
awesome.
it's a different topics we would love to talk about.
Yeah.
All right,
no,
let's
that's
do
awesome.
let's do a couple more, and then
All
I'll
right.
play my. For you.
All right, what scares you the most about dying? Is it fear of the unknown, the pain of the process, or it happening too soon?
A and C.
Okay. I'm not afraid of the pain. I agree with you. I think the pain of the process, I have faith that my family wouldn't let that happen, especially knowing what I've done for a living. I think they would seek out the right people for me. Fear of the unknown, like we talked about, I think is totally valid, because I don't know if there's someone waiting on the other side that wants to torture me for all eternity. I don't know. I'm sure you've seen all the Bill and Ted movies. And my personal thought, you haven't?
I don't know what that is.
Oh my God. No, that's your homework after this podcast. You
Bill
have to
and
watch
Ted?
Bill and Ted.
All right.
So way back when I was a kid, the Bill and Ted movies, there was a scene where they died and they went to hell.
I know
And
angels in the outfield.
Well, I'll give you that, I
Yeah.
guess. But
Mm.
yeah, but no, this is your homework. You have to watch it because it put them in hell, and their hell was their worst memory, just made 10 times worse, like Michael Bay worse. So if you had a fear of the
What's wrong
Easter
with Michael
bunny's.
Bay?
Well, no, I'm saying he makes it big and explosive, right? So if your
Oh yeah,
fear
yeah, I was
is
gonna
the
say
Easter
Bad
bunny,
Boys. Come
it
on.
is a terrible Easter bunny and it's chasing you for all eternity. And you just have to keep checking doors, and behind every door is another horrible thing from your like life. And I
Yeah.
thought, yeah, no, that makes total sense. That's hell. That's not It's not fire and brimstone for me. So it's that fear of the unknown of, am I going to get chased by the Easter bunny for all
It's like
eternity?
it's like Rocky 5. It's like the terrible sequel.
Yeah. Yeah.
It's like Beverly Hills Cop 3.
Yeah.
Or
And you're stuck in it for all eternity. Like you have to sit and watch all the worst reboot
like
movies.
Godfather 3. Yeah.
All of them. That's your hell. That's where you're stuck.
I don't know any other bad sequels. Can't.
Give me some time. I'll give you some.
We'll think about it. All right, let's do
All
one
right.
more, and then I'll
All
play
right,
my
one more.
my game.
All right. All right, this one's fun. Your bucket list. If you knew you'd die in 1 week and the money was no object, what 3 bucket list items would you check off your list?
So if I knew I was going to,
And let's just say you're going to die in a week, but this doesn't happen, but you're perfectly healthy for that week. So you can travel, COVID restrictions are lifted for you. You are in a healthy state for a week. What are the 3 things you do in that week?
I would. I'd go to Alaska. I've always wanted to
Okay.
go to Alaska.
All right. Cruise around Alaska. I like it.
I would. Huh. I would. That was a tough question.
I know.
Tough question. I would say spend as much time as possible with my family, my friends,
Yep. Yeah.
like all day. You know,
Time.
get off the phone,
Yeah.
enjoy with them. I don't know. That's a
And
tough
it's
question.
tough, right?
That's
It's
tough. What would you do?
So
Do you know already?
I would travel to Sicily. I want to see the town where my mother's family came from. Um, I would probably do the stereotypical like skydive kind of a thing. Um, and I would take my family and friends with me everywhere I went, like my own personal entourage, because I've never ever met somebody at the end of their life say, God, I wish I spent less time with people I loved.
Mm-hmm.
You wish I had more time, and that's something none of us are valuing enough ever. Guilty as charged. No one appreciates time and connection to people. And I would really just want someone to let me lay on the pitcher's mound at Fenway Park just for a little while.
Yeah.
So I've touched the monster. I've been on the outfield, but they've never gotten to the pitcher's mound, and that's just, I want to see what it looks like. The view from the mound. The view from the mound.
Yep. I'd love to sit courtside at a Celtics game.
All right. That would be good.
That would definitely be on that list.
Yeah.
But, all right.
All right. So you have
Let's
a
flip
surprise.
it around.
All right.
I got a little surprise for you. We're gonna go into some music right now because I know someone here, or 2 people that I know, are very big Hall & Oates fans.
All right. Yeah.
And I will admit, I have become more of a Hall & Oates fan over the past year and a half
Yeah.
than I ever was before.
Yeah.
I'm
embarrassed to say that my son, who started off this world liking all of my music, is now
moved on.
Yeah, he's like an Ariana Grande fan. I don't know what happened. It's very poppy.
Yeah. Yeah, It is
We
what it is,
grow.
I guess. Yeah,
Whatever.
We grow. So I got a little Hall & Oates trivia.
Oh yeah, I'm gonna bomb this.
Oh, you're gonna bomb this?
I might bomb this.
All right. Well, we got fun facts. I'm gonna turn them into question. All right. First question. We have Hall and we have Oates. Do you know which instrument Oates plays? Well, it's
No.
2 instruments, if you include vocals.
Okay, vocals, and I'm gonna just say guitar.
That's correct.
All right. Okay. All right. It seems too easy.
That is correct. Where was
All right.
yeah, where was Daryl Hall born? In what country? I mean country. What state?
What
What state would you
state?
guess?
I'm gonna say completely randomly, like Iowa.
That is incorrect. It was
Okay. Do you
Pennsylvania.
know what? I was actually gonna say Pennsylvania.
Where are you?
I don't know
You should
why.
have went
Yeah,
with
no,
it.
seriously, I should have gone with it.
You should have went with it.
I know.
Uh,
Gut
so they
instinct.
so they were born in well, he was born in 1946. So I'm assuming the Oates, Big Oates, was born in the 40s too.
Uh-huh.
When did they start collaborating? When do you think they started collaborating?
1971.
Ooh,
Oh, was
that's
I
correct.
close?
That is
Dang.
incorrect. 1970.
Ah, dang it.
You were close.
It was
You
close.
were
It was
close.
close.
How many records estimated do you think they have sold over their time?
Records sold. 2.5 million
That's
total.
it. Over their whole career.
20 million.
All right, that's a little bit better. 40
Okay.
million. You're
40
still incorrect.
million.
You're
All
still
right. Yeah, I
incorrect.
was way off.
Definitely.
I was way off.
Definitely. All right. Let's do.
Well, I
All
have a
right.
question back at you. Which one of them bit the other one's ear in a fight a couple years ago? Do you remember that?
No.
Okay. You're gonna have to Google that one. One of them bit the other one's ear. I don't remember what happened.
What?
I'm telling you.
What?
I'm Googling it. That's
I
awesome.
didn't know that. That's yeah. No. Probably Oates.
Right, I would think so.
Probably. All right. Moving on. We have a couple more.
Okay.
In total, how many hits did they have on the Billboard Hot 100 over their career?
35.
Ooh, so close. 34.
Oh, I'm like one off on all of these.
Yeah, you were
Oh,
wrong. You're wrong.
it was Oates Bites Hall's Face, and that was
What?
in 2012. Actually, I didn't
That's
think it was
real?
that long ago. That's real.
Wow.
And the story sparks Man-Eater headline of the year. Sorry, I
That's
had
so
to share it.
stupid.
That is dumb. Well
Oh
played.
my
Well played.
god. How many? What year were they inducted into the Hall of Fame?
That was more recent, I think. 2009? No, maybe it wasn't that recent.
That is incorrect.
Dang.
2003.
Okay, all right. I was at least in the ballpark. I knew it was in the 2000s.
2003. Well, actually, you know what? If I reword the question, you said 2013.
2009, but I'll take
2009. The Songwriters Hall of Fame was 2003, so I messed up. I gave you the wrong question.
Ah,
Rock and
okay.
Roll Hall of Fame was actually 2014. So you were
Okay.
actually
All right,
You're
I did
not-
think it was recent.
we're not bad on
All right.
that one.
All right.
All right. Final one. All right. Well, two more. Billboard magazine has Hall & Notes at what number on their list of 100 greatest artists of all time?
Out of 100, Hot 100 kind of a thing. 44.
Incorrect.
Dang.
15.
Really?
That's pretty
There's
high,
just
huh?
so many good artists out
Yeah,
there.
that's pretty high.
That's a tough one. That was a tough one.
Yeah. All right, last question. They are best known for their 6 number 1 hits. What are the 6 number 1 hits?
Oh, God. I'm going to go with Man-Eater's got to be one of them, just for perfect reference.
Okay.
Am I allowed to cheat on Google?
No. Nope.
I
mean, I don't know if you are, so you can do whatever you want.
No. I try to, I'll be honest. I don't know. You're going to have to throw them at me.
I'm right.
Told you I was going to be bad at this.
Terrible.
I know.
Terrible.
It's
Rich
Friday
Girl.
afternoon. My brain is fried.
Yeah, I know.
Rich Girl. All right.
Rich Girl number 1.
Okay.
Kiss on my list.
Yep.
Because your kiss. Private
Sing
Eyes.
that all night.
Of
Okay.
course, Private Eyes.
Of course.
Their
Of
best
course.
song. I Can't Go For That.
Okay.
No can do.
which I would say is probably my favorite song of theirs.
Yeah, I like that
Yeah.
song too. I do.
Yeah.
That
I
and
like it.
Private Eyes, Man Eater,
Man eater.
and Out of Touch.
All right, I'm gonna be very stereotypical and say that's probably my favorite Hall & Oates song.
Out of Touch. I
Yeah.
don't like that. Oh.
It reminds me, my kid used to use that song as a reward for potty training when he was little, so it just makes me happy. And I just said that on a podcast. He's gonna kill
Oh
me.
my God, that's hey. What's the what's like the like when you're a big fan of a group, like what's that one song that maybe everyone doesn't know that you might like? Do you have one of those with them, or?
No, not really. No.
I would say mine. I mean, it's popular, but I don't feel like a lot of people play it. But like One on One. I don't
Okay.
know if you heard
All
that
right.
one.
I have heard that. I have heard.
One-on-one. Yeah.
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 I like it.
That's a go. But Private Eyes for sure is definitely.
Yeah.
I hate the kick back that love and feel. I hate that song.
Oh yeah. No, I'm not a fan.
Oh,
It reminds me of when I used to be in high school and we'd listen to like Late Rock 105 at night and listen to other people calling in to request songs, and someone
yeah.
always requested it, and it's
Is
just
that
not my
Delilah?
favorite.
Delilah. at night?
Delilah. And who's the other guy? I can't remember the other guy, but yeah.
I
Art
don't know.
Spencer, maybe?
Something like
Sounds
that.
right. Sounds right.
Yeah, I'm not a big fan of that. But anyway, well, that was a fun two
It
games.
was fun.
Before we end it, any final thoughts on anything? Anything you'd like to recap?
I don't think so. I think, there's a lot of options out there on the internet, and I'll send you all the stuff so you can put the links up, but we have lots of links for different caregiver support and stuff like that on our website that anyone in the community is welcome to participate in, since it's all virtual. But if you're struggling with death and dying because you have a loved one that is, quite ill, or you yourself are quite ill, or you just want to talk more about it, get out there and look up stuff, find ways to talk about it, do your advanced directives. I don't care how old you are. We're in a pandemic right now. You don't know what could happen tomorrow. I've had the misfortune of having to see lots and lots of people younger than me trying to figure out how to say goodbye to their young kids in this line of work. And we could have something terrible happen tomorrow. Talk to your loved ones if there's something meaningful. Tell people you love them. Tell them, laugh, share stories. But I update my 5 wishes every year. It's like my New Year's resolution. So it's not too early. My husband thinks I'm crazy, but he'd appreciate it if I had a meteor fall on my head tomorrow. So I do what I can.
I mean, there is one on the way. It's supposed to come in like 2032.
Yeah. So
Something
right
like
now
that.
I wouldn't be surprised if
Wow.
nothing can surprise me at this point. So
Yeah.
But-
Nuts. No, you recapped it. I mean, you recapped it. I mean, that's all I could say. We spoke about what you do for Hope Health as a nurse care navigator, just bringing more awareness to death and talking about death, and becoming more comfortable with the fact that it will happen, whether it's whenever it does, it will happen, and just being more comfortable and accepting of that, the 5 wishes form, and just the culture of all that. And also I think one of the biggest things we talked about other than death was just the impact of the healthcare industry right now and what they're doing and how special they're doing. And I brought up the link earlier, but I'll bring it up again. If you'd like to donate, nursingworld.org. It's the American Nurses Foundation. And I know it's probably more on doctors and stuff like that, but I just have this one for now. You can donate. You can honor a nurse if you know someone. And I'll also bring up this too. If you, and I hope you obviously will share this on Facebook as well, but
yeah.
if you have any more people, maybe not in this topic, maybe you a nurse that might like to come on and talk about their struggles or triumphs, everything
Yeah.
during this time.
I love
We'd
that
love to
idea.
hear from you. We'd love to branch off. We're going to go back to our music and our sports, and we're still going to continue doing that, but we'd love to talk about this stuff as well, because, it's interesting. There were things I found out today I would have never known.
See, and that's all I want. That's all I ever want to hear is that, just saying, hey, we're going to talk about this kind of weird thing. What do you think? And having you take away from that you've, opened up a little pathway of thought.
Yeah.
I think that's completely worth it.
Absolutely.
That's all we can do.
Absolutely.
So
It was definitely great speaking with you.
it was very nice talking with you. That was the most fun I've had all week.
Yeah, sure.
It's been a
Uh,
crazy week.
I believe it. I believe it.
Yeah.
Check us out. We'll hope to get a Louis back in the next episode. We have some more special guests coming up. We have my friend Gabe Bryant. He was on a couple, one of our first episodes. He came on. We spoke for about 2.5 hours about I don't know what, but we just kept speaking. It's one of our highest rated episodes. Or other than the NSYNC one, of course, the NSYNC one has the most listens on Spotify. I don't even. That was one of our worst ones too.
Oh,
I
I'll
don't know
get in
what
on
that
an
was.
NSYNC one. That sounds fun.
Yeah, we trust me. We're gonna go into some more. We have some other guests too, some other podcasts that are gonna be coming on. We're gonna do some music reviews. So we have a bunch of exciting stuff coming up on season 2. Again, if you'd like to come on, especially the local, if you have a business or a charity, or you work at a local hospital or something, and you want to talk about what's going on in the world, we'd love to have you. Please go to anchor.fm.com if you'd like to donate to keep this podcast going, to support us, donate to the Nurses Foundation, all of that stuff. Look
Awesome.
forward to talking to you guys and talking to everyone soon. Thank you
Very
very
good.
much. We'll see you guys later.
Thank you.